Our gut is responsible for upwards of 70 to 90% of our immune system. So if it is out of balance, then we're going to start to see fallout everywhere else. Hello, and welcome to the Coaches Collab. Wherever you are, we're happy to have you here at this show. It's real talk about real pets and our real reasons why we are holistic pet health coaches. And I have a very special guest today, and I'm going to explain more why she's a little near and dear to my heart about a topic that is near and dear to my heart. So please welcome Kara Rose. She is a holistic pet health coach. She's also a certified professional canine nutritionist. And y'all, on top of that, she's a nurse practitioner, and she's doing it all at the same time. She's amazing. Welcome, Kara.
Thank you. Wow, I think that's the most exciting introduction I've ever gotten.
You are exciting, and you have to give yourself more credit, because I have to tell you all that I am amazed by Kara. I don't know how she fits it all in, and she's going to tell us a little bit more about how she fits it all in. But I wanted to take a quick step back and say thank you for your patience. We were a little late getting to this live today. Technology is not my friend. Can I blame it on Mercury retrograde? Because I'm going to.
Yes, you can. You can probably also blame it on my brand new computer, which I'm still learning how to use.
See, there you go. I can read lips, but we couldn't do the whole show that way. So we did have a few technical difficulties with the mic, but we're just happy to have Kara here now. So anyways, moving forward with that, Kara, what's going on with you today? So she is joining us today, and tomorrow she is leaving to go to fill us in on what's going on tomorrow.
Yeah, so I technically am not supposed to say where I'm going until after I come back,
Okay.
but it will be somewhere in Europe to do a medical trip it'll pretty much be like an urgent care type clinic for Ukrainian refugees. So I can tell you all the country when I come back, but they said we're not supposed to say.
That's okay. That's okay. So Kara is going to do all that work. So she's also working as a nurse practitioner right now. Kara, how do you fit all of this in? I'm just blown away. You're super smarty.
When I figure that out, I swear I'll let you know. The answer, unfortunately, is sometimes I fit it in by not sleeping, which is not a great thing to say. I'm not promoting that. Everyone, please do self-care. It's very important. The other day, so I work night shift right now, and I moved to nights because I think personally, I felt like it was a little bit better of a flow for me, but also I have so much other things going on that I really wanted more time during the day. And I've learned over the years in the healthcare field that I can function on 4 hours of sleep and be okay. This most recent jaunt was actually 38 hours awake, and I don't recommend that to anybody. It was a very poor choice. And my lovely husband cut me off and finally said, go to bed. I don't set out to do that on purpose. I just happened to have a night shift and had so much craziness getting off my night shift that I couldn't go to sleep. And I just stayed awake until it was time for bed like a normal human being the next day. But I made it through. I don't make a habit of it, but right now that's the answer.
I'm impressed. And I say this every Coaches Collab, but here I'm going to go again. I am continually amazed by the level of holistic pet health coaches that we have in this group. I'm honored to be your colleague and have you as part of this. There are so many people that are holistic pet health coaches that have amazing backgrounds and bring amazing knowledge to this. And I'm really looking forward to this conversation today, because Kara has got a foot in both holistic pet health and human regular health, as well as holistic health. She's training it to be in functional medicine right now. Right now, she's working at an ICU. And so doing the standard stuff, she really has a well-rounded perspective of lots of health aspects. And we're going to dig into that today. But I want to start off with, what brought you to being a holistic pet health coach? You've already got so much on your plate, but you were obviously inspired. What's your why, Kara?
Oh man, my why is going to sound like I think almost everybody else's why in this space, and it's my pets. Right now I have 6 pets, 3 cats, 3 dogs, 7 if you include my husband. And
I include mine some days.
It's only some days. And I had cats all my life. And interestingly, I had always wanted to work in the animal realm, and I was on track to become a veterinarian. In middle school, I said, I want to work with animals. I went from wanting to be a marine biologist to an animal cop, and then finally settled on veterinarian. And so I graduated high school. I was in my first year of college, and I was doing my biology prereqs and all the things that you need to do to go to veterinary school. And my childhood cat, who was only 10, became ill suddenly over a holiday weekend. Now, I was raised by my grandparents. We were middle class, but we definitely didn't have spare change for big vet bills. And they didn't have the extra money set aside to take her to an urgent or like emergency clinic over the holiday weekend. And so we went in on a Tuesday when the normal vet opened, and she was in kidney failure. And unfortunately, it would have been so much money that we ended up having to euthanize her. And I remember holding her. They let me hold her while she was put to sleep. And I was so devastated. And my first thought was, I don't think I can do this for a living. I think it would be the most heartbreaking thing. And I had never thought of that side of veterinary care. And so I went to college and I went to my guidance counselor and I said, I can't do this anymore. What can I do with all of my credits? And she clicked some keys and said, you could do nursing. And now here I am a decade later. But I was always an avid animal lover, so I still needed animals. So I set out on my own, moved out of my house, and I got a dog. And I had problems immediately. He wouldn't eat his food. I would have to hand feed him. And he would throw up all the time. And he had poop that looked like pudding. And
Oh,
he was super low energy. And everybody used to say, man, you got such an easy puppy. He's so lazy. Turns out he didn't have energy because he wasn't absorbing his nutrients. And it wasn't until he was about 2 years old that I finally had convinced my veterinarian to do more of a deep dive. And we got him diagnosed with chronic pancreatitis.
mm,
And the answer to that was a prescription low-fat GI kibble. And what's funny is that he had never had a high-fat diet. He had never stolen the steak off the table. He never got pieces of bacon because I thought that human food and table scraps were bad for pets. So I never cheated. And yet fat was the cause, and this is what he was put on. And he did not get better. And he hated it. And I still would have to say, Copper, eat your food. Copper, eat your food. And it was heartbreaking to watch him have pancreatitis flares every few months, 2 days of recurrent vomiting, hunching. He was in pain. I hated it. But I thought, it's the luck of the draw. And I got another dog. And my second dog had problems. He had environmental allergies. He had recurrent yeast. He had hot spots, ear infections. He had to get shaved multiple times because if he got wet, he would get terrible hot spots immediately. And the answer to that was to go on a prescription hydrolyzed food,
again,
didn't help.
here we go with the prescription diet.
Which didn't help. And then also Cytopoint, which would help temporarily, but the times in between got shorter and shorter. And he was miserable.
Yeah.
And then I met my husband. And my husband came with our third dog, little Miss Piper.
Oh,
And little Miss Piper had her own problems. I know you're surprised to hear me say that, right? But she had chronic GI issues. She had leaky anal glands all the time. She was super anxious. And I finally sat down and said, something is not right. They're getting premium kibble. They get the best veterinary care. What is wrong?
Yeah.
And
What's going on? You've done everything the vet has told you to do.
right. When you feel like you've done everything right. So I turned to the internet. And the internet introduced me to Dr. Judy Morgan. For some reason, that was the first holistic vet that the internet showed me.
Yeah.
And so I ended up hopping on a pet summit that she was on. And it happened to be a pet summit about feeding fresh food. And from that minute, I was sold. And I just dove right in. It was terrifying. I put a plate of raw chicken in front of them and had to physically restrain myself from taking it away because I was terrified I was going to give them salmonella and they were going to die. But from the minute I put real food down in front of them, Copper never had pancreatitis again.
Wow.
And very slowly, Bear's symptoms improved. It takes a little bit longer. His gut was in bad shape with his allergies. and we didn't have to keep taking Piper up to have her anal glands expressed. And her anxiety, which was bad, actually improved. Now, this was long before I knew anything about the gut brain axis, but now I know why feeding real food helped her anxiety. And
Ab-
seeing those changes with my own pets, I was like, this is amazing. And I was so scared. And also, I had no idea because I grew up hearing, don't feed table scraps, you're going to kill your dog. And so the internet never showed me this. Commercials on TV never showed me this. I had no friend or family member who said, save one, who I love her, and she's probably not listening today, but she did tell me a long time before I found this on my own to feed fresh food. And I told her she was crazy because I wasn't ready to listen. Now I
Yeah.
know better.
Yeah.
So that's what brought me here.
And I think what our mission is now, that's an amazing story, by the way. And I'm sorry that there was those things that you had to go through. I went through something similar with my own dog, and it was more that I had to figure out what she was going to eat or she was going to die. And it ended up being food that I needed to cook at home. She, way back in the day, had bleeding ulcers and IBD, and we did an intolerance test. This is going on 12 years ago. And I think one of the only ones on the market was the NutriScan. So we did that. Everything came up red.
We
So
can exist off air, right?
yeah. So the solution was, let's put her on steroids and just keep feeding her. And I thought, and so here I am every night, hours online. There's got to be a food. And finally, I just thought, this is crazy. Why don't I just make it herself? And like you, go to the magic internet and start researching dog nutrition, real dog nutrition, not Kibble from those prescription diets. And here she is. She's now 15, gonna be 15, and thriving. And I've been making her food for 12 years. We always say here, you don't know what you don't know until we know different.
Right. I
So
absolutely agree.
I'm interested in when did the click come for when you saw Dr. Ruth, our amazing mentor, Dr. Ruth Roberts. She's the creator of the Holistic Pet Health Coach program. We are so thankful to her. I know I am every day. I pinch myself that I've been able to meet amazing people like Kara and all these other holistic pet health coaches. So what was your spark?
Once I realized how beneficial feeding fresh food could be, I wanted to tell people, right? So I was doing it for my dogs, and the more I would do it, the better I got at it. And then I would want to tell my friends and my family and my coworkers. And I realized that while that's all well and good, my reach was pretty limited. And the more I immersed myself in joining groups and meeting like minded individuals, mostly on the internet, the more I wanted to be one of the people who was talking about it, right? So I want to practice what I preach, but then also teach other people how to do it because everyone can do it. And even if that just means replacing 20% of your bowl of shelf stable food with fresh food, that is still something that you can do. And what I found though was that the internet is not always the most welcoming place. And I would see a lot of divisiveness. And I just wanted to be one of the people that could speak up and say, you can do this, I can teach you, and really make it real. And so I joined several different Facebook groups and started moderating for some and met more people. And some of those people pointed out that the holistic pet health coach certification existed. I didn't know about it, obviously, before then.
Yeah.
But I had done my canine nutrition course first because I did it through the Feed Real Institute, and I've been a Real Dog Box fan for years. I love their treats and chews, and I always have them at my house. And so I learned about that through them, which gave me even more exposure. And then I learned about Dr. Ruth's course. And as a nurse practitioner, someone who almost bridges the gap between a nurse and a doctor.
Right.
I really looked at a holistic pet health coach as that type of thing, but for animals, right? So I'm never going to be a veterinarian. I am not going to go back to school for it because at this point, knowing what I know about the way a lot of schools approach conventional care is probably not how I would want to spend my time and money. But to be able to take the medical background that I have, apply that medical knowledge to animals, but then pull in the holistic aspect from the holistic pet health coaching was where I felt like my happy medium would be.
That's amazing. You're like singing the song I always sing. I always
Mhm.
like to say that holistic pet health coaches, we are bridging the gap between pet parents and veterinarians. And I give this statistic every time, but it's really important that the community at large is understanding that there is a shortage of veterinary care. There is 80 million pets in this country is the estimate, and only 75,000 vets. So they are totally overworked. And we forget that veterinarians have to be a jack of all trades, so to speak. They're anesthesiologists, they're dentists, they're orthopedists, they're internists. They're all the things where in human medicine, Kara knows better than anybody. They're all very specialized. If you're going to a gastroenterologist or you're going to an endocrinologist or whatever, we've got all these specialized things, which we're going to talk about more. And vets are kind of all of it. But more often than not, what they can't be is integrative and be a nutritionist.
Mhm.
That's where we come in because we have the background in nutrition. We have the background in functional medicine, traditional Chinese medicine, supplements, and herbals to help bridge that gap. And so I feel like it's really opening a door for a lot of pet parents. So instead of your kitty that had the kidney disease, I think we're faced with a lot of clients that got this. We have a kidney disease diagnosis. We now know that a fresh food diet, along with some supplements, including some really fantastic Chinese herbals that are making huge strides in kidney disease, like Romania 8, are having much better outcomes than the standard of care. And that's part of the reason why we do the coaches collab, because I want people to know. And I'm sure that's been your thing too, Kara.
Yeah, for sure.
So,
And you're right about the medicine aspect because although I almost wonder, and it's part of the reason why I'm now walking down the path to holistic health for human medicine too, is I think it's great to have a specialist when you need one because to have someone who can truly focus and learn every single aspect there is about a body system or an organ is no one can know every single thing about every organ in the body, right? So to have that specialist can be so important. But I find that a lot of times we parcel out a patient to all these specialists when we could have really looked at them as a whole and probably done it ourselves. And I think that that can actually end up being a detriment because then it's really hard to get everyone to collaborate and get in the same
right.
room and put their genius thoughts together. So I love that veterinarians have that ability to really be the jack of all trades. But unfortunately, the way the overwhelm of the amount of pets there are that need veterinary care and the lack of time that the vets have, not just because there's not nearly enough of them to really spend an hour with a patient each time, right? That makes it impossible to focus on every single thing and see the animal as the whole. So it's really tough. It's like, where's the middle ground? I think it's
Well,
us. We're the middle ground.
yeah. Yeah. And you were telling me when we were talking previously that, like, for example, with humans, insurance requirements are so sticky that you get
Yep.
15 minutes with your patients. And a lot of times that's how it works with vets too. And
Yep.
insurance isn't involved. It's just the lack of vets.
Yep. I can't tell you how often I would see people in the emergency department and it's busy and you feel like you need to just crank them out, right? See the next one, see the next one. We don't have rooms in the waiting room. And you can't do that when someone's coming in because they never have just one complaint. It's not, I stubbed my toe and I really can look at you in 15 minutes. It's, I'm dizzy, but I also have nausea and I haven't really wanted to eat lately. And sometimes when I stand up too fast, I get dizzy. And there's always so many things, right? And it's because the person is a whole person. They're not a single complaint. It makes it really hard.
Absolutely. And, I loved what you said the other day that just like humans, all pets are individuals.
Mhm.
And being a holistic pet health coach, we look at the whole, just like you said, and we can take everything into consideration from mind. How are they doing mentally? What's their environment like? What are their stress levels? What are they
Yeah.
eating? What are they exposed to? All of these things are pieces to our puzzle that help us support the animal as a whole. And let's talk a little bit about how that support makes a difference in regards to it seems that the standard of care by and large is treating symptoms where we want to support whole. And you've got a
Mhm.
foot in both. So I'd love to get your perspective on this.
Yeah, treating symptoms is really the conventional medicine approach, right? So someone comes in with, I don't know, high blood pressure. You're going to give
Mhm.
them high blood pressure medicine. We're going to say, go see your primary care doctor. Now, maybe if that primary care doctor is lucky and they have enough time, they can talk to that person about a better diet and more exercise and things that can improve your blood pressure naturally so that you don't need to be on medicine. But most of the time, they don't. And even if they do, it's still in retrospect. The preventative care is not what it needs to be. And there's a lot of pushes for that, but we're not there yet in human medicine. Unfortunately, it seems like it's the same in veterinary medicine, right? It's really hard to, I think, get that proactive approach when there's just not enough time to talk about it. And most of your day is prioritized towards sick visits. So I really like the idea of being able to look at the animal before they ever get to the point where they need to have a sick visit and say, what can I do to optimize my animal's health so that they don't end up in that situation?
Yeah, absolutely. What would you it's I can't wait to pick your brain some more, but just quickly, we could go down some deep rabbit holes today, but
Yeah.
what if you could change anything right now? Let me ask this first.
Mm.
That was a good summary of what's going on in the pet and human world. What would you want to add to that as far as what some of the crossovers that we're seeing as far as the shortfalls for both humans and pets? And I asked this question, I want to back up. I know we're going down the human road a little bit, but the reason that this is near and dear to my heart is because I would not be a holistic pet health coach if I hadn't faced my own health challenges and I hadn't lost my mom from, I feel, a failure to the standard of care
Mm.
in human medicine treating symptoms. So that really got me on the road to looking at holistic health. And I dug in and researched night and day.
Yeah.
And I was able to apply that knowledge to Darla because my mom passed from a gastrointestinal cancer and it was brutal. And everything that I learned that was different, that we cannot keep going at acid reflux with omeprazole, which is an acid reducer, or things like
Mhm.
that. And there's a lot of ways to go at it, and we have to look at the body as a whole. So that's one of the reasons I asked this question, because that kind of catapulted me here today. And I feel like so many people have felt that going that way. And I always try to find the hope in it, and knowing that our mission going forward is to just advocate for everyone being their own advocate and digging in and doing the research. So, what crossovers you were explaining, what crossovers do you see that you feel could be the changes overall? If we can make the world a better place, you having a foot in both, what are some of the things that are common and what would you want to change?
I think communication is so important. And I think I see this from a very nurse perspective. So, being able to really connect, be it with a human patient or the pet parent as the veterinarian, when you foster that trusting relationship, they open up and tell you things that they're not going to tell somebody if they think they're being judged or rushed. I can't tell you how often I've seen a patient after maybe a doctor saw them, a doctor who was too busy, or maybe a doctor who wasn't really great at communication. And they would open up and tell me things that were critically important to determine what was going on with them, right? And so If I could encourage anything, it would be to have good communication and just be present, right? So don't be thinking about, oh, I have 7 more animals before I can even have a bathroom break today, right? Or me, oh, there's 40 people in the waiting room. I really need to get going. It's being present and in the room with the one who is there for the care is really the first step, and then being able to talk to them and not being afraid that you're going to be judged. That's how you figure it out, and that's how you continue to optimize health all along the spectrum.
That was super good advice and great answer. I think we all forget that just in our day-to-day lives, but from a holistic pet health coach perspective, this is one of the great things, one of the things that we do. I like to think that we act as that compassionate guide because I feel like so many of us, like you, when you were dealing with your kitty and with Copper, it's which way do I go? And we don't know what to do. I like to think that we are there as that compassionate guide.
Mhm.
And we take the time to listen. We most often we have these consultations, but the work that we do behind the scenes, there's a lot of work that goes behind the scenes into the health plans that we provide for our clients. And just on a side note, if this resonates with any of you, there are links in the comments. If you're interested in finding out more about Kara and getting a consult with her or any of our coaches, that is in there. But one of the really cool things that Kara has done, this is pretty awesome. So, because of her passion for feeding whole foods, she has taken it on to formulate a calculator for both fresh and raw food. And you can see a little more about her food calculator on her website, rawpodadventures.com. So, Kara, tell me a little bit about how that came in. And I'm going to turn that annoying ding off while you're doing it.
Yeah, so when I actually opened my business and I started taking clients, I would run into a lot of people who were just not ready to feed raw food yet, which is completely fair and fine. And although raw works for my dogs, a ton of people don't want to do that. And some animals really shouldn't. As they get older, they might have a more difficulty digesting raw food and do a little bit better on something that is gently cooked. And I just started to feel like, or even when I would be talking to people on groups or moderating, and they would say, how do I know what to cook for my dog? This is how much they weigh. I can't find the information. And I realized that there's not really a resource out there that will help show them how much to feed if they're going to do cooked, because all of these models that we have include bone. And they look at it and they're like, what do I do if I'm not giving bone content? So I just wanted to create a resource for people because I think really just making sure that you meet somebody where they're at is the way that we get more people to feed fresh food. It doesn't have to be raw food. It doesn't have to be cooked food. It doesn't have to be freeze dried. It just has to be fresh food in whatever form that is. And I wanted to make sure that there was a resource for every aspect of fresh food that there was. So that is what I focused on. And it took a little bit longer than I expected, but I finally put it out actually less than 2 weeks ago, so it's new.
Bravo. Well done.
Yeah.
That's an amazing tool for pet parents to use, and it's taking so much of your knowledge and background in all sorts of things, holistic and otherwise. It's really amazing. So, moving forward, I wanted to ask also about your experience at Super Zoo. So Super Zoo is a really cool event that's in Las Vegas, and there's all sorts of fun new pet products there and food and things like that. So that's something that you also get with a holistic pet health coach. We all are staying connected. We like to talk to each other, and we also stay up on the newest, latest, and greatest what's going on in the pet world. It's like when you have a holistic pet health coach, it's like you have a whole team, and we're on top of it. And the education is continuing constantly, isn't it, Kara? Whether we're talking to Dr. Ruth or having a guest veterinarian in, or if you're going to Super Zoo, I'm bringing it up mostly because I'm amazed at how you fit this all in. Like, mind blown about you and your schedule.
I would love to talk about Super Zoo. It was a blast. And it was
Yeah.
also a lot, but in a good way. Am I allowed to, I guess I should have asked this before we started, but am I allowed to mention like companies and people that I talk to, or should I make it generalized?
We can, well, I don't know the definitive answer on that. So to play it safe, I think when you're talking about them good, it's always great.
I only have good things to say.
Well, there you go. I think when we want to know positive things, we can always name drop. I just try not to name specifically things that we don't like.
Yeah, that's fair.
Okay.
That's fair. So definitely I saw a huge focus on gut health this year. Last year it felt like it was a lot of single ingredient treats, which I think
Yeah.
is great. And this year I feel like everywhere I turned, I saw something that had to do with the gut, which thank goodness, because poor gut health is its whole epidemic right now for our pets and for
Huge.
people. So much
This,
so.
this is a sentiment that Kara and I share. I'm huge on gut health as well. So I can't
Mhm.
wait to hear about this because it is the foundation of health. I give this statistic, or not statistic, just fact to a lot of my clients. I'm sure Kara does too, that our gut is responsible for upwards of 70 to 90% of our immune system. So if it is out of balance, then we're going to start to see fallout everywhere else.
Yeah. And it's something I'm really passionate about because my pancreatitis boy had gut issues and my allergy guy had gut issues, right? All of my dogs had gut issues. And so to be able to take what I've learned and apply that to them, I love. So the first thing that I saw that I was incredibly excited about, and I wish I don't have it behind me because where's my bookshelf here? Because I need to order it still, was the new digest mushroom tincture by
Oh,
Myco
yes.
Dog.
Yeah.
Oh God, I can't wait to order one. I want it so bad. I
I
love using mushrooms. I think that they're amazing. I have multiple other mushroom tinctures from them that I give to my dogs and myself. I take it every single morning, and I can't wait to add this one to the rotation. So that was like my top exciting thing that I saw.
That is really cool. I also can't wait. Do you remember the mushroom combo that was in there? And then that will be available on Dr. Ruth's site eventually
Ooh.
when they come out with it, when they get it. I know it's just in its kind of infancy, Kara.
Yeah, it was a long-ish list. I am pretty sure that I saw shiitake in there. I think that there was reishi. There was like maybe 7 of them. So off the top of my head, I can't recall.
So I bet I know the answer to this, but I'm especially excited to ask you, with
Mhm.
being a nurse practitioner too. How do you feel about antibiotics?
Oh God, I hate them.
I
I
do.
understand that they have a role and they serve a purpose. Especially being in the ICU, I get people with really bad sepsis and body-wide infections, and we have to give them antibiotics. But for our pets, my God, if I could eradicate metronidazole, I just wish that I could. For our pets, my own included, it's like we give it to them at the drop of a hat, and I don't understand. I don't know. If you
So
had diarrhea, would you go to the hospital? You just had one episode of diarrhea. Are you going to go to the hospital, or are you going to sit at home and maybe just be close to your bathroom, right?
So for any pet parents that are watching that may not know metronidazole, it's an intestinal antibiotic and it's frequently prescribed if there's anything from giardia to diarrhea to whatever. Now, if there's an active infection, there are certain and different ways that you can go about things when it has to do with the microbiome, such as probiotics or an FMT, which is a fecal matter transplant, or other
Mhm.
things to get rid of really nasties like Clostridium or whatever. But it has been the standard. And new studies are coming forth that metronidazole does have some lasting side effects that
Mhm.
impact the gut in a negative way. And we see the impacts of these antibiotics coming out later in our pets with, as Kara mentioned, the seemingly epidemic of poor gut health and
Yeah.
antibiotics keep intriguing. What else do you have to add to that? I should just let you
Yeah.
talk.
No, you're exactly right. So that's the problem is it's useful if you need it, if you truly need it, but it shouldn't be given willy-nilly. And I think that's a lot of what we do is I think, I'm not sure what it is. I don't know if it's commercials on TV or if it's, I don't know what to call it. Cause in the human medicine realm, we joke about big pharma, I guess big kibble, right? Maybe they, with this, 'cause sometimes
Yeah,
there's a big of like a bit of a push to do certain things or seek care for certain reasons. And
big.
you end up in the office when maybe you don't need to be. And if you feel like you needed to be there, I wonder if maybe some certain conventional offices might then feel like they need to give you something for being there. And then I think you end up coming away with an antibiotic that you didn't need. And it really can have lasting detrimental effects. There's a lot of other things that you can do. And I don't even know how I got on this tangent now.
No, I love it. That's part of the coaches collab. We just collab.
We just collab.
Just collab. We talk about I like going down these rabbit holes because
Yeah.
I had a client this week whose little munchkin had pancreatitis and was given an antibiotic for it. And so I asked, I said, "Where's the infection?" And she goes, "I know, I asked the vet that." And now this pet is dealing with diarrhea because antibiotics are killing the good bugs or killing the beneficial bacteria as well as the gnarly ones. So
Yeah.
that's something that we need to watch for sure.
Yeah. Yeah.
That gets tough. That gets tough. What other things would you want to just be like, hey, let's step back and not do this antibiotic jazz anymore? And let me go here instead, because I've derailed for a minute. Such as my brain. I always say on everyone, I was like, this is my ADHD coming in, or maybe it's just a full moon, Mercury retrograde. I don't know. I'm woo like that.
You warned us about the rabbit hole. I'm right there with you.
Okay. Okay. Yeah, going down that antibiotic rabbit hole. And I just was wondering, like, what other things it's more like we are in this mode of we have to give something. And I think this happens in human healthcare too, because when people are taking their pets to the vet, or if we're going to the doctor, we're in this mentality of we have to give them something. And I can't tell you how many clients that I've got whose animals are on steroids or antibiotics constantly, and it's merely a Band-Aid. What say you?
The best example I can give you, and I am not exaggerating, all 12 years of my career in healthcare battling against, is giving antibiotic for viral upper respiratory infections. When you get the common cold, or you have a cough, or you even have the flu, it's a virus, and you do not need antibiotics. When you give antibiotics for those things, you create antibiotic resistance. And down the line, people can grow polyresistant microbes that can pose a humongous issue. And so just overall, the overuse or inappropriate use of antibiotics is actually way more dangerous than just disrupting your microbiome. So I would say that's probably the best example that I can give. But I think there are other realms even that really need to be explored when we talk about less is more. For example, if you have an animal who is diagnosed with kidney disease, maybe the answer is not to put them on a prescription Kibble and a bunch of medications. Maybe the answer is to take a step back and put them on a moisture-rich, fresh food diet and not add a ton of supplements. Maybe a mushroom tincture that has cordyceps in it, which is really excellent for the kidneys, maybe something like that. And then retest and see, right? It's less is always more, in my opinion, because if you dump a whole heap of things in your pet's bowl and then they have a reaction or they don't feel good or they don't want to eat it, first of all, how do you even know which one is the problem? You don't. And second of all, I wouldn't want to eat my food either if somebody dumped a bunch of crap in it. I think just being cognizant that like animals have less outlets than people do, and they a lot of times only get what we give them or what we can provide to them. And one of the things that our animals should always love is their food, because I think it's one of the joys that they experience, right? One of the main categories of enjoyment is eating their food. And I don't want to put a bunch of stuff in there that is going to make them hate their food, which is why it broke my heart so long when I would have to try and force my dog to eat his food because he didn't like it. He was telling me something, I just wasn't listening.
Yeah, and it's amazing. Sometimes I give this challenge. I'm like, all right, set down a bowl of kibble and then set down some ground beef or some ground turkey. See which one your little pet goes to.
They go for first, yeah.
Yep.
But then pick the other one up if pick the kibble up, then don't let them have it afterwards. Because some of them really do just have an endless stomach and they'll eat it anyways. But
That is
I'm sure
true.
you can see
That
which one they want
is
first.
true. My 10-pound Yorkie is one of them. I always joke
Ugh.
that I was like, she could eat an entire horse. She would eat until it would consume her whole body. She just, the
Yep.
never ending like stomach, Yorkie stomach. She's amazing. Not picky at all, but I don't
A
know.
lot of
Maybe
those
it's
kids.
just that the power of fresh food. I always like if I ate, I'm a pretty healthy eater. I'm a holistic paleo coach, have to be. But I think she has eaten better than me the majority of her life. And that's why she's doing so well. So it makes a huge difference. This is
Yeah.
this is a good conversation.
And I love how focusing on our pets makes us also focus on ourselves. And honestly, had I never gone down this road for my dogs and then eventually applied it to my cats, who were way harder, by the way, but had I not done that, I would have never. And I've been joking that I'm having a midlife crisis because
If you
what 33-year-old just up and decides one day that they're going to change their entire career? I don't me. But had I not done this for them, I would never have taken the steps to start getting a functional medicine certification for myself. And I'm just going to keep saying it and putting it out into the universe. But my end goal here is that I really want to be able to, I think, step away from hospital medicine and be able to be like a practicing functional medicine nurse practitioner. And however that looks, if it's in my own clinic or if it's in a clinic with somebody else, I would really love to be able to give that service to people, because giving it to pets now is so fulfilling. And I truly feel like I'm making a difference, because a lot of times when I go to work, I feel like I'm just putting a Band-Aid over a bullet hole and telling people, okay, go forth. And I'm not really fixing the problem. I'm just putting a temporary patch on it.
You absolutely are making a difference. And I am so excited for you. And I cannot wait to see what you do. So what's your timeline with the functional medicine? Where are you at there?
So I just took my first course over this past weekend, actually, and it was so interesting. And with traveling for Super Zoo, I really didn't get to be as present as I wanted to. Luckily, starting on the 28th, I get access to all of the recordings, so I can re-listen as many times as I want. But from what I was able to really tune into and absorb, I have already learned so much about mitochondrial functioning and what things can stimulate mitochondrial neogenesis, like to make more of them so that you have more energy. There was a big focus on the keto diet, which there's a challenge that starts on Monday. And I'm really going to try. I'm a little scared because I'm not going to be in America, but I'm going to try. There's a challenge for everybody who took the course to do the keto diet, followed by a fast. So we'll see how I do. But learning a lot. You do, girl, I will text you. But like learning about sleep and sleep hygiene, which was really ironic given what I did to myself this week. Learning about depression and how nutrition affects depression. And I cannot tell you how excited I was when the lecturer said the words leaky gut. I have never ever heard that applied to people. And it is so validating to hear, because people have it too. People have arthritis. People have depression and anxiety. People can't sleep. People have cravings, right? And a lot of these things come from poor gut health. And it's not just our pets, it's everyone. So I really can't wait to just pull it all together and just be able to give it to everyone. But from a timeline perspective, it'll be about a year of courses. And then I have to do some case studies and do the national certification. So about a year.
This is so exciting. I'm really excited for you. And it's also really validating. So validating to, not that there's similar problems in both pets and people, but just to know that the way forward, and I feel like the future of medicine is going at whatever mammal, if it's a human or a pet, from a holistic perspective, because we are more than just our body parts, and we are more than just a set of symptoms clumped together. And with you doing the functional medicine, one of the things that to make people think about is what fires, you were talking about cellular health, what fires those cells? The things that we eat fresh whole foods are what is powering those cells. Our bodies have cellular turnover. It depends on what cell it is and what the rate it is, how fast they turn over. The same with our kitties and doggies. So what you're feeding them goes into that cell replication every time. Why am I telling you this? You should be telling me this. No,
We're telling the world this.
we are telling the world. So going forward, like then you think about if you're feeding burnt brown balls, aka kibble, and now I have a new word for them because you said big kibble. Now I'm going to say BBBB, big burnt brown ball.
Yeah.
If you're feeding big burnt brown balls, then that is giving the information to the cells for replication. And when you think about it, organs are just big clumps of cells. And if the cells aren't healthy, the organs aren't healthy. The organs aren't healthy, the body's not healthy. Is that a good explanation, Doc?
It is. And, it is. And I will say, you have to remember, and I think this is, I don't mean to keep tying this into human medicine, but we're at a point in our society where I think we really crave, although I will preface that by saying that I think we are starting to backpedal and I think it's for the best. But people crave convenience. People are too busy, right? And so when you are at the grocery store and you have to work 60 hours that week and you have a kid to take care of and you have your pets that you need to walk and feed and you have homework to do or all of these things, right? We don't find time for ourselves. We usually take care of ourselves last. And that usually includes our nutrition, and our nutrition is key to our health. And so when we're pulling things off the shelf and you're putting something processed and shelf stable into your body, it's not the ideal form, and it's not what the body, like, historically knows how to do something to do with it, knows how to do with it, right? Knows what to do with it, excuse me. Evolution put us the way we are, and our gut wants to digest real food. It doesn't want to digest a ton of synthetic things. It doesn't want to have to assimilate all these things. And when you put yourself in a pro-inflammatory state by eating those things, how is your body supposed to recuperate from that? If you're always making your body recover from feeding it inflammatory crap, then it's not going to recognize when you have a cell that replicated and mutated. And it only takes one. And then it continues to replicate, and you can have a tumor and you can get a proliferative cancer. It can happen to anyone, but you decrease your risk of that and you increase your body's ability to fight that if you don't put yourself in a pro-inflammatory state. And it all starts with the food that we're eating.
So good. Mic drop. Fantastic.
Too bad my tummy doesn't hear that when I have a vat of ice cream in front of me.
Yeah, or my weakness is mac and cheese.
Oh, God.
It just is.
I love mac and cheese. It's so hard. It's so hard.
It's so hard. I make it at home, but there's that.
But you know why?
Pardon me?
Is because you know why, though. You know why it's so hard to not eat the ice cream and not eat the mac and cheese.
Because my brain wants the dopamine.
Your brain wants the dopamine, but also your brain is addicted to the fake flavoring that they put in these things. So there's 15 different synthetic flavorings on a single Lay's potato chip. I wasn't supposed to say that, I think, because I named the brand, but whatever. You can't open the package and eat just one, right? Why is that? Because it's literally sprayed with things to make you want to keep eating it. It's the same for Kibble, by the way.
I was about to say, I was going to say they put those same flavorings in Kibble, and that's how we get little Kibble addicts. Especially with
it's not easy.
Are addicted to their little Kibble.
Yep.
That was a really good reminder, just talking about that, because we can't survive on crackers and some supplements. So
no, you cannot.
We shouldn't expect our pets to either. We can't be giving Kibble and then, oh, but I'm giving omega-3 and all these supplements. Okay, great. We can freshen a bowl, but we can't out supplement a bad diet. Another reminder.
I love that you just said that, because I also love your burnt brown balls earlier, because I made a PowerPoint, I don't know, like a year ago for a local pet store of mine. And one of the things I wrote on there to describe Kibble was burnt brown balls. And literally
thing, and I didn't know that. Somebody told me the other day, they're like, you didn't think of that. I'm like, I did think of it, but I guess
of it for me, but yeah. And then I also will tell, when I have my clients, I say, do you think you would be healthy if you ate a cracker and a multivitamin and nothing else every meal, every day for your whole entire life? Are we like having a mind meld here? But it's true. It's true.
Yeah, it is. And I also like to say that was fun. I also like to, I'm like, how would you, like if you it's not appealing to you, I always say, I was like, how would you feel about a nice big bowl of Kibble cereal in the morning? Can like you
Ugh.
imagine eating that every morning? Pour some milk on. Yeah.
But
No.
we can because that's what cereal is. And that's why I think it's become so normal for us to feed kibble because we pull cereal off the food for ourselves, off the shelf for ourselves. So why wouldn't we pull something that looks just cereal off the shelf for our pets? We've been conditioned and trained to think that it's okay to eat processed food. And if it's okay for us, of course it's okay for our pets.
Bingo.
Crazy.
Bingo. So good. You're talking about all the things that are, I feel, so important to so many people and important to me. I've really enjoyed having you on here because we're on a mission. You're on an amazing mission. I'm just so impressed by you. You're a bright light of holistic healing energy in this world, and I'm glad you're here. But it's a mission. We're on a mission for pets and their people because our health is connected. People forget that when they're not doing well, then they're stressed, and our little animals can sense this. So the motivation for us to be the best that we can be is to be great for our pets too, and likewise, because it's amazing. This is another rabbit hole we could go down some other day, but it's amazing to me, as at least in clients that I've had in my own pets, how pets and people share symptoms, share
Mm-hmm.
conditions, things like that. Crazy. And they take
100%
stuff
agree.
from us.
Yes, they do. Yes, they do because they're empathetic like that. But I
Yeah.
completely agree. And I love that you call it a mission because sometimes I feel like I'm like undercover on a mission, trying to like bust in and be the one that's, hey, look over here, do this. For me, I like to call it an adventure because when I think about the name of my company and what inspired me, I really like to look at life as an adventure. And that's how my husband and I met, is through our Jeep club. And we love to take our Jeeps and go off on adventures. And we
I'm a
bring the
cheap
dogs too.
girl.
we're we're gonna connect about that later.
Yeah.
Um, but I bring the dogs. And so when I first started making content and I made an Instagram, I made it so that I could share content about taking fresh fed dogs like off the grid and that you can still do it. And it just expanded into more. But I try and always look at life as, your whole life is your whole adventure and what is like the next step to that adventure. And when I started doing this, I realized that this is my next big adventure, is feeding fresh food and teaching other people how to do it. And that's how Raw Paw Adventures was born. That's how I really try and look at everything you tackle in life is, all right, it's time for the next adventure and let's just go for it head on. But I really like mission too.
You're on one. So speaking of the next adventure, we're going to go on a quick adventure with Kara. It's
Oh
time
boy.
for pet perks and pet peeves.
Oh, okay.
I always get that on this. I'm wondering. I
I'm
have
ready
fun.
for it. I'm
Even
ready.
if y'all don't have fun with it, I still have fun with it. Okay, pet perks are your top favorite things in the pet health world that you love, and pet peeves are if you can wave a magic wand, wipe it off the face of the planet, and get rid of it. So, pet perks, 3, 2, 1, go. What are some 3 pet perks?
All right. So I have a quick clarification question because I'm just too
Sure.
logical. Does it have to be a thing or
It can
can
be
it
anything.
be? Okay. All right. I
Literally.
have to say that my top 3 favorite things are actually more like traits.
Oh,
I would say that my top favorite trait, or that I think is a perk that if somebody has this, is open mindedness. I think it's really important to, like I said earlier, really meet somebody where they are in their walk of life and being open minded and being willing to just support where that is and educate where you can. And when you're not that way, it's really easy to close the door on someone who maybe could have taken that step, but then got the bad juju about it because you just weren't open minded for them. So I would say that's my top thing that if I meet somebody, I would definitely consider that a perk.
okay. I like it.
Yeah.
Any other pet perks you want to add?
If I had to choose a thing, it would
Then
be
let's just say you do. I make
it
the
would
rules every
be
single
mushrooms.
time,
I'm
by
a huge lover of mushrooms right
the way. Okay.
now. I just like everywhere I turn, I just want to hear about fungi. Like I have my little, I don't know where it is behind me, but I have like my little mushroom guy up there, and I have mushrooms up there, and I have mushrooms on my cup, and
Oh,
I have a mushroom tattoo. And just like everywhere I turn now, I just hear about these fantastic fungi. And I really think that the more we learn about that, the more health benefits we unlock. So that's like my favorite thing.
I like it. I like it. It is amazing. And it's something that I'd love to learn more about. That's lower on my knowledge base. So once again, glad you're on the team. All right. So pet peeves, if you could just get rid of it. You mentioned one earlier, I might bring up again. Starts with the M.
Oh, metronidazole. I know I really don't like it. There are some things that metronidazole is really good at targeting. For example, Clostridium difficile. There are very few treatments for C. diff, which is an infectious diarrhea, and animals can get it. It's in the soil. People can get it. You usually need to be at risk for it, secondary immune suppression, or you're already sick from something else, or your gut's in really bad shape that allows C. diff bacteria to proliferate. So metronidazole is great for that. It's just not really great for everything else. And it causes, I think, more problems
Yeah.
than benefits. And also, there are other options now for C. diff, not just
Yes.
metronidazole.
Yes. And we could go down that rabbit hole too. Darla is a recurrent C. diff, and I handled it
Oh,
without metronidazole.
yes.
But so if anybody watching has questions on how to go with C. diff, contact Kara or I for sure, because we're both on this microbiome thing. But I want to hear more about your pet peeves.
Yeah. Pet peeve for me, just across the board, is people who have a superiority problem. And I see that a lot in the human medicine realm, but I also have been seeing it across the holistic pet space. And I think to be really inclusive and really make people feel like they're valid and that their work that they're doing is good work and that they really should be proud of themselves wherever they are in their journey, you need to make sure that you're not approaching something like you're superior to someone else. Just knowing that everyone has worked hard to get to where they are. And even if that doesn't mean that they went and got their master's degree or their doctorate degree, or maybe they are your regular pet parent who just wants to do the best by their pet, and that at the end of the day, that's their goal. No one is better than anybody else in this space. And we all really need to just be here to support each other. It's something that I'm trying to embody.
Yeah, that's a really good point. And once again, why I like to emphasize the beauty and the support system, working with the other holistic pet health coaches and working with Dr. Ruth. I really do feel like we're a team and we all support each other. We've got vast and differing experiences, and we've all got a niche and we work together. If I don't know something, Kara, I can go and ask her. And I doubt she would ask me anything because she's like up here and I'm down here. I know you just said, no, that doesn't it. And that was just a joke. No, but no, she's got an incredible education and it's really impressive. But I think what she was trying to say is the passion that we all bring to this is incredible. And there's nobody that has more passion and mission than Dr. Ruth's Holistic Pet Health Coaches, because we've all had such a different background getting here and our hearts are truly in the right place. And yours definitely is, Kara. And I'm going to wrap this soon because this dear one is getting on an airplane tomorrow to a location that shall not be named. But you know what? Maybe we should do this again when you get back, because if you can share, I'd love to hear about it and get you
I would
on
love to.
and
Yeah.
know that we're all going to be thinking of you on your trip and appreciate your presence in this world for both humans and pets. And it's been wonderful to have you on.
Thank you so much. It was fun to just come on and chat. It's just nice to know where people are coming from. And it really helps me connect when I'm looking for someone to work with, to know what is their passion and why did they get there. And I hope that the way I was able to speak to my own journey or my own adventure, I'll call it, resonates with some people, and know that I'm just here to help as many pets as I can.
I think it definitely did. It definitely did. So sending you, Miss Kara, positive vibes, and to everyone else
So
out
many.
there, yeah, Have a wonderful weekend. Thank you for joining us. Thank you, everyone, for your support of Kara, for Holistic Pet Health Coaches, and for me. We appreciate you all, and we will see you next Friday. And don't forget, the Know Better, Do Better event is coming up in Chicago. There is a link in the comments to that. That is a don't miss event. So with that, once again, positive vibes. Take care.